Greetings, welcome to this webinar for the end of the legislative wrap-up session. Many thanks to Mark St. John and Maggie Snyder for joining me in this quick overview of the legislative wrap-up on behalf of Indiana Association of United Ways and our partner, Indiana Coalition for Human Services. This is Lucinda Nord, and we are recording this as a sort of recap of the 2015 session. With over 1,200 bills filed and 257 bills enacted, our goal is to provide you a quick overview of the main themes and highlights. If you type your question about a specific bill in the chat box, we will either answer the question along the way if it fits, or as a follow-up email to you. So I'm pleased to introduce to you our speakers today. Mark St. John, who serves as a lobbyist for the Indiana Association of Community Economic Development and co-chairs with me the Government Affairs Committee of the Indiana Coalition for Human Services, and Maggie Snyder, who actually wears two hats, helping staff the Coalition for Human Services and working in public policy here at Indiana Association of United Ways, an invaluable part of our team. So I will turn it over to Mark to give you a little bit of background.
Excuse me, thank you. During the prior webinars, we provided background during the introductory webinar, so I only want to mention a couple of slides here as a review. Slides 3 and 4 talk about the session being the long session, where the prime responsibility was to enact a 2-year budget that starts July 1st. The House and the Senate, in both cases, the Republicans have a supermajority in both chambers, meaning that they can conduct business whether or not the Democrats are in attendance because they have a quorum. If you review vote counts, you're going to note that in many cases the bills had a broad bipartisan support, sometimes almost unanimous approval. But you also are going to notice that there are certain bills where votes were not along party lines. Excuse me. You're going to notice sometimes that there are urban-rural kinds of splits and stuff, but you're also going to see some that turned out to be kind of partisan efforts. We started the session thinking that the main discussions would focus on the budget and school funding and a few of the hot issues that are listed here. But the issues that attracted the most attention by the media and by the public in terms of the State House were things like the RFRA, the Religious Freedom Restoration Act. I'm tongue-tied today, excuse me. Common construction wage repeal, and the discussion about the State Superintendent of Public Instruction, Glenna Ritz, and how the State Education Board is governed. As we previously mentioned, I think we skipped a slide forward here. Did we not?
No.
Well, never mind. The governor's budget took many of the priorities that each of the caucuses listed, and the governor got many of his priorities through, including the funding for the Regional Cities Initiative, including some priority issues for human services, such as dealing with infant mortality and domestic violence and the 211 services. There we go. Maggie, you're on.
All right. For the last 2 years, the Indiana Coalition for Human Services has grouped our priorities in 5 areas. Healthy Hoosiers, where we were pleased to see federal approval of HIP 2.0 on January 27th and to hear that FSSA has enrolled 320,000 Hoosiers in HIP 2.0 in its first 100 days. We advocate for working Hoosiers, workforce-ready graduates, accountability, and thriving communities. We have been very focused on the state budget this year. The graphics at the right illustrate how our state dollars have been invested in the last budget, with the majority going towards education. The majority of the revenues came in from individuals and families through state sales tax and income tax. Because we are so concerned about the budget, we at the Indiana Coalition for Human Services launched the Invest in Hoosiers campaign. We are pleased to share that the budget was generally friendly to human services. The budget includes new funding for 211 sexual assault services and for infant mortality grants through a program called Safety Pin. The budget also includes increased funding for domestic violence and community corrections and a slight increase for transit. Funding for food banks, choice, pre-K, and child care subsidies were sustained despite valiant efforts to increase the funding. At each phase of the budget, we prepared a quick summary of core human service funding we know is important to our members. Given the fact that we know that many of you don't have time to read the 250 to 270 pages of budget item lines and narrative. As a reminder, the budget process starts with the governor's proposal that appears as House Bill 1001 introduced. Then the House offers its chairman's amendment after the House Ways and Means Committee reviews items. The House votes on it and then sends it to the Senate, where the Senate Finance Committee amends the House version. Because there are differences between the versions, the budget goes to Conference Committee. As you review this summary, please note that some items may appear as a cut from 2013. The budgeted item for 2015 in certain categories is actually the same as what was actually funded due to reversions. A budget reversion occurs when the budget includes an appropriated amount and then the governor or the state budget agency requests that a certain percentage be reverted or returned to the general fund, usually because state revenues are not keeping pace with projections. For example, if you look at the lines for HIV, AIDS services, or IDAs, you will see that the reductions are about 3%, which is what was reverted from the 2013 budget. You can also download this chart from either the ICHS or the IAEW website. For the next several slides, we will tell you what bills passed related to human service areas. If a bill is grayed out, then the bill did not pass. If the bill number is small, then that means that a portion of that bill was amended into another bill. The bills in the health area tend to deal with very specific health issues. Human service advocates are happy to see certain bills advance, including several related to mental health services. Pain management and mental health best practices have been high priorities. 2 bills related to increased injection drug use receive lots of attention. Parents of children who died from heroin overdose provided compelling testimony to allow others to possess and use the antidote Narcan, which is in the Senate Enrolled Act 406. Additionally, 461 outlines the process for a limited needle exchange program on a county basis. This is to stop the spread of HIV and hepatitis C and to build trust to encourage addiction treatment. We will have more on the HIV issue in our regional meetings.
There were several other bills related to health, some not specific to coalition priorities. Senior advocates were very pleased to advance the caregiver legislation in House Bill 1265. Additionally, disability advocates and families were very pleased that the state is updating language to remove the outdated term mental retardation from state code. House Bill 1093 requires the state health department to provide resources, including advocacy, information, and hotline numbers for healthcare families to give to parents who receive prenatal test results for Down syndrome or other conditions diagnosed prenatally. There were also several bills that related to substance abuse and treatment. For example, House Bill 1488 allows inpatient substance abuse detox to be covered under Medicaid. Another bill allows overdose intervention drugs to be prescribed to caregivers or friends without examining the individual it may be administered to. In terms of helping working Hoosiers, efforts range from broad to rather specific. The helping working Hoosiers has been a focus in terms of work share. changes in unemployment and expungement. Despite some really bipartisan support, the work sharing bill did not advance. There are changes to unemployment and public employment retirement systems that do place some more burdens on the employee. Some of the specific areas enacted included allowing preferential hiring of veterans and protections for victims of domestic violence.
As education is a high priority for each of the 4 caucuses, we have seen lots of bills before both Senate and House education committees. We are seeing a continuation of some of the education reform ideas we have seen in the past. While we would have liked to have seen the pre-K pilot expanded, we are pleased that the budget will include its continuation in the 5 pilot counties and that the budget will count kindergartners as one in the school funding formula rather than a fraction of a student as long as the school offers full-time. Many advocates were thrilled to have thorough hearings and nearly unanimous votes to smooth the child care benefit cliff. While it did not ultimately pass, there were important hearings on cliff effect, SNAP asset tests, and work scheduling practices. In other education changes, we saw a few bills advance that have been filed in prior years, related to criminal background checks for school employees and funding for adult high schools, since changes were made to adult education funding.
Now, if you read the newspapers or heard the news, you probably heard about Senate Bill 1, which was hotly contested and drew many teachers and supporters to the State House and lots of discussion at third House sessions. Senate Bill 1 removes the superintendent of public instruction from being the automatic chair of the State Board of Education, effective at the end of Superintendent Ritz's term. Senate Bill 500 removes many requirements for public schools, such as reporting teacher-student ratios, and more kinds of things here. The budget bill outlines some stuff about the school funding formula. It changes the winners and losers, so to speak. Suburban schools gain, but many urban schools and a significant number of rural schools lose funding with this, as they've changed the complexity index for determining school funding. Senate Bill 62 was rushed through to remove some of the requirements for ISTEP, including the social studies section, in order to reduce the total testing time this school year, which now seems like it was months ago.
All right, so because we've seen a lot of changes and attention to child services, we're not actually seeing as many bills that directly relate to Department of Child Services. Although there were a few that passed, there's always an omnibus bill that the Department of Child Services asks, which is a number of fixes. The House Bill 1196 creates some dual status assessment teams to help with CHINS determinations, especially in delinquency cases. And then there was also attention to monitoring of juveniles in adult court and increasing mental health services. This House Bill 1304 actually makes it a delinquent act for a child to run away and leave a location designated by the guardian without cause or permission. So it's something that we have followed, but actually our partner Children's Coalition of Indiana probably follows the child services bills a little better than the Coalition for Human Services, although there's a lot of overlap. In terms of thriving communities, we're really pleased to report a lot of wins in this area. The budget bill includes $1 million per year in funding for 211. While we were hoping for more, we're thrilled with the $1 million per year, where the state is going to join private funders in supporting the statewide information referral system. We were again effective in preserving the NAP credits, or the Neighborhood Assistance Program tax credits. And in a final hour tax bill, literally in the 11 o'clock hour, the night of the last night of session, the IDA tax credits were preserved in, even though two bills had originally set to repeal those. And we still support the evaluation and review of tax credits, which will continue by Legislative Services Agency as outlined in 1142. In some other areas, human trafficking law will require information to be posted, and a number of other provisions. In terms of Senate Bill 412, or Senate Enrolled Act 412 now, environmental advocates are really not very satisfied with this bill. There was a lot of controversy with this bill, that the utilities will be able to create their own energy efficiency plans. And this really goes to a larger debate about the role of regulation, which you know is hotly contested, and EPA rules in the Midwest. And because the Midwest relies so heavily on coal, that's part of the challenge here. So this is just a few of the bills in the thriving community areas. I'll let Mark talk about the good government bills.
Believe it or not, there is such a thing as good government. And legislative ethics was a really important issue. The bills that have been passed require greater disclosure. Legislators recognize that they will not be conflict-free, but they're paying more attention whenever conflicts are direct or unique or substantial. In terms of election matters, advocates for increased access to elections were not happy that vote centers and easier access went nowhere.
I'm going to tell you guys a little bit more about the Invest in Hoosiers campaign. So at the beginning of the session, the ICHS board invested its resources to launch the Invest in Hoosiers campaign, which aims to change the conversation about our state's budget. We called on legislators to make Hoosiers a priority and to start making strategic investments in the budget once again. We have advocated for investments in programs and services that have been proven to do the most good for everyday Hoosiers and that improve the overall economic vitality of our state. We asked for investments in quality child care and preschool, textbooks, school counselors, tax credits for workers, and financial opportunities for working adults to gain skills. Here you can see our top 5 priorities for the campaign. Here you see the very specific policies and investments we were pleased to see in the final budget, grouped by each of the categories. As you can see from this slide, we celebrate many important investments and applaud legislators for including these in the budget. This includes more money for transit, domestic violence, sexual assault, community corrections, 21st Century Scholars, and 211. We also want to give a shout out to Kristen Clements-Effner, who worked as a contractor to staff this campaign and worked hard to recruit supporters during session. We are looking at this as a long-term campaign leading up to the 2017 budget session. We are asking each of you to link your Facebook page and Twitter. Please sign up at investinhoosiers.org, and if you are willing to place an op-ed or letter to the editor about the need for certain investments in future budgets, please contact us. The Invest in Hoosiers campaign is about all of us working together to make sure our legislators know how important these investments are to their constituents and to the local communities.
Thanks, Maggie. So now as we transition into how you can take part in the work, while we just finished the legislative session, and Maggie just described how you as an individual or your organization can join the Invest in Hoosiers campaign, I want to take just a few minutes to remind you how to get involved. So first of all, nonprofits are allowed to lobby and to advocate. There are rules about lobbying, which is defined as spending your organizational resources, your nonprofit organizational resources, to ask your legislators or to ask your constituent to ask your legislators for a specific bill or policy change. However, most of what we do in the nonprofit arena is really education and awareness. That is advocacy, and we're telling our stories of our organizational mission, what certain policies or investments mean for our clients, our organizations, or our community. So it's absolutely critical to have you as a volunteer or your board members and your volunteers tell the story. So if you're happy about something that's in the budget or that passed this year, reach out to your legislator and say thank you and tell them why it's important. So in the past, we have tried to give a little getting started lesson. If you're nervous or new to advocacy, remember that all of us were new at one time. There are lots of resources to help. Here are just a few ideas to get you started. And then thinking about what we can do now. The session's over, but there are things that you can start to do to prepare for the next session. And the first step is to raise awareness about your issues. Talk with your board, your volunteers, your donors about 1 or 2 new laws that you like or that directly affect your clients. Help them understand how the laws or public policies relate to your mission. And if you like something, check the vote count, see that your legislator voted for it, and send them a thank you. Express what it means to your organization or to the clients you serve. Remember that if you are looking at an absent vote or a no vote, there may be other reasons why a person may be absent or vote no. So, for example, a legislator may vote against the budget bill because of one thing in those 250 pages, but not necessarily your issue. So if you need some background about a particular issue that you're not sure about, feel free to email us. We can try to do a little research if we don't know that answer. But nonetheless, communicating with your policymakers is really critical. Legislators listen, most legislators anyway, listen to their constituents and sincerely care about your experiences. So as a number of legislators are holding wrap-up sessions or meet your legislator or town hall sessions over the summer, please feel free to attend those, walk up, introduce yourself, invite them to your organization for a tour or a session to talk about a particular issue. And then if you're not sure, we try to have a short presentation. If you've never been to the State House or you've never done that, feel free to nose around on our website. So let's see what else you can do. There's all kinds of ways that we work together because, you know, the human service community just tends to focus on serving people. We don't spend a lot of money on lobbying as other organizations or businesses might do. So it's really incumbent upon us to work together, to tell our stories, to advocate for our clients and for our communities. So here are just a few ways that we work together. And over the next coming months, we're actually inviting you to come and meet with us in that we would like to have We'll provide a quick update like this, but also have a conversation about some of the big issues on the horizon for human services, including some of the philosophical debates or some of those study committees that we know that are coming up. Some of the hot topics right now are around the issues around welfare reform, as there's a strong emphasis on employment and training. Many of you know, for example, that in July, SNAP benefits are going to change for able-bodied adults without dependents. So that may have impact on up to about 65,000 Hoosiers. There's always this recurrent conversation about drug testing, and now with the crisis in southeastern Indiana, there's a heightened awareness about drug testing and the relationship between IV drug use and the HIV crisis in the state. So we'll be talking about drug testing as a policy, especially now that addiction treatment is covered by HIP. And then we plan on talking a little bit about best practice responses to the HIV crisis. So here are just a few of the dates that we have scheduled already. There is a registration link on our websites, and we invite you to come and join us. So I'm going to see quickly if we have any questions that people would like to ask during this recorded session. And then if not, we will move through. I'll just give it a minute. Are there any questions about any of the specific bills or the themes that we talked about? I'm looking in the chat box or in the question box. I'll give it just a quick minute. I'm not seeing anyone typing. I see. Okay. Okay, we have a good question from one of our members, do we have any idea whether the General Assembly will meet for a technical corrections day in June? So just procedurally, so that folks who aren't as living and breathing in the State House, typically around this time, around mid-May, there's a legislative service or legislative council that assigns the study topics for the summer for the interim study committee or the study committee meetings. Which topics and which committees will be assigned. That usually happens around May or early June. And then in June, there's usually a technical corrections day, and that day is to fix anything that was accidentally where there might be a conflict between two bills that were enacted, or it also provides the opportunity for the legislature to override a veto, as the governor vetoed two bills, one related to public records and the other related to online wagering. So let me ask Mark, do you know whether the Assembly is going to be doing a technical corrections day in June?
They have not yet said that they're going to do one or not, but if they do one, it's going to be Monday, June 8th.
Okay, Monday, June 8th, if it is set.
Yes.
Thank you. And then we have another question from Jesse. Will we email out the PowerPoint after this presentation? You should have received the slides in advance, but we will certainly post the PowerPoint slides and the link to the YouTube, and I'll also highlight one other item. These are our two websites that you can see. This is the IUW Public Policy website, and this is where you see a lot of those resources that we talked about, like the Third House calendar. You saw that just today, in fact, there were two of those final wrap-up sessions. So we have a lot of resources available there. And then for the Coalition for Human Services, we post, for example, the legislative summary, which is a quick one-pager. So you can see that grid of the final budget and a legislative summary, which lists many of those bills that we just talked about. So, and some of the study committees that were offered. So you're welcome to download those. Those are again at ichs.online.org, and you can nose around there. Let's see. Thank you. Yes, others received their slides in advance. Are there any other questions that we have? Oh, great question. So we get a tough question for you, Mark and Maggie. While there were clearly several victories in the human service community, how would you prioritize disappointments this session? I know that I think we went into, I'll offer my opinion. I think we went into the session thinking that there might be more cuts to human services. So we ended up being really thrilled that a lot of the services were sustained. I think we would have liked to have seen additional funding for things like food banks, transit. I know that a lot of our environmental friends were not as satisfied, or our good government friends were not as satisfied with making advances. Mark, do you have any other comments?
I think you hit the key ones right there around the issues with energy efficiency. And while we were pleased about the growth in funding for substance abuse and behavioral health services, there are lots of other unmet needs out there that are still not being addressed budget-wise.
And I know that there are a lot of uncertainty yet around the educational issues. While we at the Coalition for Human Services don't follow the educational issues as closely, there were lots of concerns about the deregulation bill as it was moving through, and it was hard to sort of keep up with all of the changes because, you know, each of those items that were put in statute to provide certain kinds of training for teachers or to count, for example, student-child ratio. Those were put into code for a particular reason, and to have those pulled out of code was a little problematic for some of our members.
Some of the changes with funding for both charter schools and with school vouchers. School vouchers, for example, taking off the funding cap. It changes and moves more dollars, makes more dollars available for school vouchers, doing some grant funding for charter schools. I think it remains to be seen how that's all going to play out and what does this mean for the future. There's lots of speculation on both people that were for those changes and against those changes. But a lot of it's speculation at this point, and it'll be intriguing to watch.
Right. I know that we were, we were cautiously hopeful that we would be able to get earned income tax credit recoupled or more funding for certain items like 211 or food banks or other things. But that's, we're trying to be positive and pleased with what we have. So we had one more question about the Work-Share bill in terms of why it didn't ultimately advance. Do you remember that? Mark, I don't remember what was the ultimate reason why it didn't go forward.
The Department of Workforce Development expressed concerns about their ability to manage the program. Concurrently, there were concerns about how it would work with other kinds of unemployment benefits, how it would play out. There was uneasiness on the part of many organized labor groups, and the bill couldn't overcome the concerns, the collective concerns.
Okay. Then we had one other question about a low-income tax credit, and I'm not sure which low-income tax credit you're referring to in that. For the earned income tax credit, there was an effort as a part of tax simplification to recouple it to the federal, which means basically take a straight calculation, a 9% calculation of the federal EITC. And because that had a $12 to $15 million fiscal impact, the final outcome was to keep it in an as-is state, which means that families with more than 2 children would not be allowed to claim more than 2 children, and married couples didn't get the same tax benefit. So that in essence, the marriage penalty remains.
I wonder if that might not be a question about the low-income housing tax credit.
Nope, I think he got it. I think that I just got a response that answered the question. So I think we have all of the questions. I'm looking to see if there are any other questions. Going once. All right. Well, we have a couple other reference websites that we've provided the links to, and then we just want to express to all of you and all of our partners in human services around the state, thank you so much for everything that you do. You are the eyes and ears around our state, and you're actually delivering the services. So we really appreciate all that you do in educating your local policymakers about the importance of human services in your communities. Again, we invite you to come and meet at one of these sessions that you can see listed here. The registration is up on our website. And if there's a high demand for another location to be added where we can talk to a lot of people all at once, we will try to do that. So this concludes the recorded portion of the webinar. Thank you for joining us.